Hey everybody, I'm here with Dr. Kong, and today we spent the day talking about regenerative medicine and stem cell therapy, and I want to talk a little bit more about what the misconception is out there, and maybe some fears that people have, or misunderstandings they have about regenerative medicine and stem cell therapy, because it's kind of been a little bastardized. It's kind of the waters, I guess, for lack of better terms, has been kind of muddied up. So, what have you found in this space that people are maybe misunderstanding, or that you're running into when people are coming to you about regenerative medicine or talking about stem cell therapy?
Yeah, there are quite a few. So one is that they think that somehow using your own stem cells is better than using another person's, which is just not true, because you have to realize, depending on what the other person is, or who the other person is, if it's somebody that's identical to you in age, so then they would have accumulated the same genetic changes over time, which is the aging process. Right. So then, and then also there's going to be more of a rejection type of reaction if you receive that person's cells, because that person's cells have matured. Yeah. But if you use a very young source, the cells are almost devoid of these surface markers that mark them as foreign, and they're very, very young and kind of eager to adapt to a new environment, the new body. So that's a whole different matter. And also the way the cells work is not so much by becoming your own cells. It's actually by triggering your body to wake up so you can make new cells. So that's really what research has shown over and over and over again. That's how the cells work. So you don't really have to use your own cells. Use a very, very young source that's more potent, have more anti-inflammatory actions, is more neuroprotective, and also can give you wider range of signals, and also less risk of exacerbating cancer. So as you know, all of us have some cancer cells popping up over time. And if you have good immune system, you will fight them off. And stem cells, if they're young, mesenchymal stem cells, can recognize that these are bad cells and you need to get rid of them. So they will send a different kind of signal to tell these cells to die. But if you're getting older stem cells, like from your own body, they have lost a lot of those intelligence, and they can just tell everything to grow. So there's a risk of exacerbating cancer. So that's one of the first misconceptions.
Well, another point to that as well. Your cells are as old as you are. So what kind of a host have you been? So when we talk about localized injections, for example, when someone comes to speak to me about maybe a knee condition they had or a shoulder condition they had, and they are not living the most healthiest lifestyle, they aren't really providing their cells the means to do what it was designed to do. And so we call that oftentimes systemic inflammation. If they have systemic inflammation, it's going to affect the localized knee, for example, and it will affect the outcomes I have with that particular procedure. And the person then could maybe be a little misconstrued that these cells are magically going to take care of everything. We put that in that joint complex, and that's just not the truth.
No, is not. That's what we were hoping. That's what science thought that's what they do. And then they prove themselves over and over again. Whoops, that's not how it works. Yeah. So then you have to adapt to what the new evidence shows you.
And that's what she says in today's training we had is, really just follow the evidence, because that's really what helps guide and direct. As we grow and as we mature into this space, there's so much that we don't know, but we're learning every day. And what we like to talk about, earlier was about how do we stack these things to make you become a better host for these cells. So I always tell, I work with a lot of people that are manual laborers or that work on farms back in Wisconsin. And there we tell the patients that we really want to make sure we have fertile soil. Because we put seeds in soil that's contaminated or it doesn't have much nutrients. How do those cells or those seeds, for example, provide a good harvest? No different than these cells. So we have to find ways to nurture and nourish these cells so we get the outcomes that patients are looking for, as opposed to the old idea that we just give you a stem cell injection and everything magically gets better. Well, that's just not the case. And so like I tell patients earlier, in my background as a chiropractor for 23 years, we looked at the body as a source of what we call the 3 T's, the thoughts, traumas, and toxins. So I've worked so many years with that component of that matrix of figuring out how do we help address that individual so they're the best host for them to get well. Because we're programmed, our body's programmed to be healthy, as long as we're removing the toxicities and then supporting the deficiencies. And so like we talked earlier, talking about nutrition, talking about other things that are going on with inside their body so that we can get those outcomes, as opposed to the old thinking like, I'm just gonna get a stem cell injection in my knee and everything's gonna get better.
Yeah, I think that's one of the problems, one of the misconceptions is that some somehow are magical cells
Yeah.
that if you put in the body, then they can fix anything. And that is just not very scientific. There are many kinds of stem cells, and you have to direct them into going places and becoming certain things. And the technology we have right now, we really cannot do precisely give you exactly what you're trying to grow. Although the cells have the capability to signal your body to grow in different areas. But let's say your body has 10 places that needs to be fixed, and then you give one group of cells. Those cells can only take care of so many areas. Otherwise they're just going to be so diluted that they're not going to produce enough benefit. So there's always, there's a frequency, dose, and that these are all part of the art of medicine, that you can't just say, I'll give you these cells and then magically everything is going to be fixed. So there's a lot that goes into it. And I want to address the misconception. I think the second biggest misconception that people have is that they think that they can't get it in the United States, that somehow in the United States, stem cell therapy is illegal. And that just cannot be farther from the truth. I hate the fact that I'm still talking about this because I've been talking about this for 8 years. And how come the same rhetoric is still showing up and people are still showing this surprise? You mean I can do it in America? Yes. And I've trained hundreds and hundreds of doctors how to do this. The number of stem cell clinics have quadrupled in the last 5 years. Yeah. So the fact is that as doctors, we can provide tissue transplantation, and this is not a drug, so you don't need the FDA approval to provide the treatment. So because of the George W. Bush rule on not providing allowing federal funding for embryonic stem cell research, just because that one thing somehow, we are not doing embryonic stem cells. We're using umbilical cord stem cells. Embryonic stem cells are day 5 to 7 old from the fertilized egg. So they're very, very, very young. Umbilical cord is when a baby is born. The baby's good, healthy, alive, and then you cut the cord, and then you usually toss it in the past. And now we can obtain stem cells from it. So using that as a tissue transplant form, there's no ethical controversy, right? You're not harming anything. You're just utilizing waste products. And when you provide it in the US, as long as you're not making claims that you can treat all these conditions, then you can do it to help the body repair. So it's as a way of assisting the body to heal. And in the US, the difference between what's provided in the US and what's provided overseas is the type of cells. Because in the United States, you cannot grow the cells to huge numbers, because the moment you start to grow them, the FDA says, now you're making a drug. Then you have to go through the drug studies. And that's very costly, very time consuming. So a lot of these companies, they want to give people a huge number of cells based on research study. And then there's a tradition of using these high count of cells based on growing the cells in culture, so expanding them. So they're not the primitive original cells that we actually use in the clinic here in the US. They're using these cells that have been grown in culture, which means that they keep changing. These cells are changing in their genetic expression on what they're expressing on their surface, because it's a more stressful environment to be outside of the human body in this incubator. So they start to change. When they start to make genetic expression changes, not only the cells can degrade in their capabilities, they reduce their potentials, and they also can secrete inflammatory markers, inflammatory molecules that can trigger problems in the recipient's body, and they lose potency. So they're just not as active. So at higher number of cells, people are actually getting lower response. So just because people are going overseas, spending a lot of money, often probably twice of what they're spending here.
At least, yeah.
Yeah, and then they're getting less results with more potential side effects. I've heard of people actually doing worse. So not that some people are not doing great. There are people who are doing better, but the percentage of problems is high. So I don't see that here in the US. So that's a common thing that people don't understand. You can receive really great treatments in the US.
And you're doing a good job of getting out and sharing that information, on the social media platforms and getting information out there. Because the biggest thing is when consumers become educated, now they can make educated decisions based on the scientific evidence. And that's really what it comes down to. We have to have that evidence to support what we're doing, and otherwise just making false claims. Mm-hmm. And that's what happened at the very beginning. And there's some people still doing that out there, unfortunately, to make $1. and they're not looking at the whole human. It's like, how do we get this body well? How do we get these cells to start functioning like they were designed to function? And that's really should be the goal, as opposed to just treating some symptoms the person comes in with, like you were saying earlier. They may come in for a knee issue and they get an injection for that, and I keep going back to knee, I don't know why, but get an injection in that area, but then all of a sudden some other part of their body needed some support, and those cells were signaled to that area to go in and support that area, and they say, well, I don't really know, that knee doesn't feel much better, but those cells actually were activated to go, and the call was someplace else in the body to heal the body of something they maybe not know was even going on.
Right. So one thing I know is that these cells, even if it didn't solve the problems exactly the way you want, because cells might have a mind of their own. I've seen people, so, depending on where they decide they want to be, they want to stay, and then they're making changes in your body and promoting improvement in that area, but may not be exactly why you came to the doctor for. But what I know is that overall is elevating the person's full functioning, their bodies, their basic biological kind of vibrancy. So I think we're really lucky to be living in this day and age, because we have a powerful tool to help people to get their immune system boosted and get their organs repaired and get their physiology, their biology on a cellular level to actually go back in age. We can reverse the aging process. So there may be several other things that can do that too. Things are evolving rapidly in medicine, but I have yet to see something as powerful as stem cells.
And which is great, because it's a one component, right? And it gives us a good foundation to then stack those other things on there, right? And it's called biohacking now, but adding other things that will help us have more of a robust outcome to that longevity that people are looking for.
Well, first of all, cells, I think, is one of the most profound things. This is not a molecule that we can throw at people, or like a Chinese medicine. I would give you a herbal concoction, which contains maybe hundreds of, maybe a dozen herbs, and then hundreds and, or even more molecules. But still, those are limited number of just biological agents. When you have DNA with you, when you actually inject the DNA, you're injecting intelligence. And that DNA, in turn, can manifest, can produce, they produced us, they can produce the entire human being in a sense. So they can make whatever you need to produce different organs and to make different peptides and enzymes and this entire biological system. So that is the smartest pharmacy that you can imagine. Is actually the engine for life. So now you got that in the body. They're giving you this clear signal. It's almost like a tuning in, this all of a sudden you got clear reception. Your body is waking up because you can see the instructions, you're seeing the blueprint. So a lot of cells with the aging process have lost sight, or it's becoming blurry and pixelated. You can't see what you need to do. So your body's stuck in inflammation. So you don't see the path forward. And now we can clear that, all those pathways. All of a sudden the person is waking up, is getting life breathed into them. But life is complex. Just like you mentioned, there are many other things too. What if you don't have vitamins in your body? You don't have the right minerals. So how can the cells be in your body and not having the agents, right, to do its work? So you need to put the right nutrition in there. What if you don't have the right microbiome, and all these microbes are also communicating your body in a very profound way? So you need to address that. What if there's not enough of the right kind of light, the right kind of energy? The light is crucial in the starting of life and in promoting and nurturing life throughout our lifetime. So there's so many aspects of life that we can incorporate into stem cell therapy to make sure that these cells can actually make a person's system thrive.
I want to go back to what we were talking about the cells. It's almost like the way I explain to people oftentimes is when you make a photocopy of a photocopy, it becomes blurry after a while. Before, it's very pixelated, like you said. And so maybe a reset of a little bit of clarity with that. But on top of that, though, there was also that misconception that I don't want someone else's DNA in my body.
Yeah, I want to address that. I actually have a video. It's called, what if something about like other people's DNA in my body. So I've heard that so many times. And the funny thing is that I've been doing IV stem cells on myself every 3 months for the last 8 years. So I have a ton of interesting DNA.
Were they only Chinese DNA?
No.
Okay.
No.
Right? Because then we'd be different cultures, right? Mixed in together.
So these are American cells. I'm pretty sure that reflects the American population.
Right.
So it's probably, what is it now? 75% Caucasian? I don't know. I don't know what the percentage is. But yeah, so I welcome, I welcome the enrichment of my DNA. What's interesting is that people don't realize that exchanging of DNA in the human species is part of life. So, for example, they tested to see how many women have Y chromosomes in their body. That's the easiest way to see if you have other people's DNA, right?
Okay.
If you're a woman, you shouldn't have any Y chromosomes. And they found out that 60% of women actually have Y chromosomes in their body. And they were trying to figure out why. Could it be that you had a male child and then there's DNA exchange? We know that happens. Or because you had miscarriage and then the baby, you didn't even know the baby existed. And then somehow you got the male boy's, the baby's DNA. Or maybe because you had a male sibling when you were in your mom's womb and no one knew about it. And then there's genetic exchange. So they were looking at all these parameters and they couldn't account for 60%. So then their only explanation, scientific, plausible explanation, is that through male and female intercourse, there's DNA exchange. So something as benign as having sex. So if you have sex, I'm sorry, you're at risk of exchanging DNA with other people. So this is really not that outrageous that we have other people's DNA in our body. And that small amount of DNA is not going to cause any issues. First of all, most of the cells that were given to a recipient, a patient, they're going to be gone in about 3 months. Most of the cells will die. But if you're very depleted in your stem cell supply, there's a higher chance that more of those cells will survive, will stay. However, for most people, the cells will die, but they will leave these effects, right? All their signals would have generated these repair. For the small amount, if they do stay in your body, they tend to adapt to the host. They just sit there, just like we have done experiments in animals, giving them human stem cells, and then the animals, like rat, growing human skin. It's like, okay, it's skin. So it's okay, it's from human, but it's skin. So it just stays with animals. So even cross species, that can happen. So it's not so far-fetched. I wouldn't be so worried about having a few DNA pieces of another person.
One thing you mentioned before some conversations was the process of depletion of DNA as we age. You had like a formula or some number cell count.
Mesenchymal stem cell.
That's
So
right.
mesenchymal stem cell is a very famous type of cell because they have been found to be everywhere. They perform a very specific function, like a very, very important function to help your body to repair. So we all know life is full of damages, and if you don't repair, then of course, that will not spell a good ending. So you need to constantly repair. So these mesenchymal stem cell is one way your body find a way to promote this activity because they're everywhere along your blood vessels and they're always monitoring what's going on in your blood. And they're also monitoring what's going on in the neighborhood. So they're in a sense sensing the pulse of everything that's going on in the body, and they will come alive when they're needed. However, these cells, when we were first born, every 1 in 10,000 cells is a mesenchymal stem cell. So they're, it's a good proportion. That's why when they're babies, do you remember when you're a baby, when you get cut and how fast everything heals, that there's no trace, right?
Yeah.
And if you're somebody in your 40s, 50s, do you remember you get a cut and what happens? And why does it linger? It's because your body doesn't have as many stem cells anymore. Because when you're a teenager, the number is already decreased to 1 in 100,000. So from 1 in 10,000 to 1 in 100,000. And when you reach your 40s, it becomes 1 in 400,000. And when you reach your 80s, it's 1 in 2 million. So literally it plummets down precipitously. So you are lacking these cells that has ability to promote these repair. So everything slows down, all the regeneration. So that's why, people start to wrinkle. And I always say your face is a reflection of your internal organs, because all the wrinkling that shows that your body's not able to repair, not keeping up as much. Yeah. So then, that means your entire body is not keeping up.
And that's the biggest thing too. We're talking about people that were, saying they're a certain age and they're having all this inflammation because of age, and that's not necessarily true. Their body can't keep up to the damage they're providing it, and so there's not providing the best environment.
Yeah,
and we find that a lot with these patients that, now we're offering, a different matrix of how we offer these cells to patients. We're addressing the systemic things, the cellular aging that's taking place, and also the joint complexes that are becoming a result of that. And we're seeing that more and more, and that's why we're able to use the other technologies that we're learning about too to help support that. And so, the biggest takeaway from the time together is that this field of regenerative medicine just keeps expanding. The more we get to learn the different technologies we bring into it, we give hope and opportunity to patients that maybe aren't so disciplined on being the best host, right? To being the best to their bodies or making the best choices,
Yeah.
Especially where we live in Wisconsin, there's a lot of alcohol consumption and not eating the best foods versus out here in California, people are, consuming, making better choices, or they have better options for stuff to consume, right? Even though it's just one part of it. But we're finding that more and more we learn, the more opportunity we have to help people to live that quality life, but increase that time that they're alive. We're not just walking dead people, basically.
Yeah, I think it's just amazing when now we have the tools to utilize the power from stem cells, because research has consistently shown that when you give an animal, like a middle-aged animal, stem cells, regular stem cell infusions, extends their lifespan by about 30%. And it's not just extending their lifespan, it's extending their health span. So they're spending the bulk of their time being young, youthful, and healthy, and then they die. So instead of suffering, and then they die much younger. So we have a chance to actually slow down the aging process, so you live a longer time and much longer, healthier time. So there's more of a chance of us actually eventually getting older and dying, but without disease. So nobody wants to suffer for the last 30 years of their lives. So what if that you don't suffer, that you just live a long time, and then poof, that's time to go. Yeah. That's the way I think a lot of people want to go.
Well, like the phrase you said earlier, suffering is not necessary. And if people know there's options for them to keep them well and to keep that inflammation down and work on the systemic and work on all those other things and using these technologies to help us with that, that's the future for all of us.
It's definitely the future, and nothing can stop it, because there's a deep human desire to be well and to thrive. So that no matter what the government agencies, what the drug company oppositions, what they have, life is too powerful in its own will to seek wellness.
And that's why we need people like yourself and myself getting out there and sharing the information, sharing the message, and really debunking some of these myths and giving people the right information so they can make better choices, so we can change those dynamics moving forward. Yeah. So I thank you for all the work you've been doing and what you are going to be doing as we talk. So it's a very exciting time ahead of us. We're glad that we got to pair up with you today, do some training, and come alongside you with some of these things, because there's going to be some pretty cool stuff we're going to bring to the Midwest from out here in California. So keep watching, guys. We're going to keep bringing all this cool stuff we can to you to help you live that better quality life and extend that time while you're alive. We'll see you next time.